Chapter 1: A Plan That's Guaranteed to Prevent Heart Attacks. If healthcare were an airline, only dedicated risk-takers, thrill-seekers, and those tired of living would fly on it. Dr. Charles Vincent, Patient Safety, Elsevier, 2006. New cars come with a warranty. Who would buy one otherwise? We think medical providers should guarantee that their care is effective. Since 2008, all patients we've treated every year at our clinics, the Heart Attack and Stroke Prevention Center in Spokane, Washington, and the Heart Attack, Stroke and Diabetes Center at the Grace Clinic in Lubbock, Texas, have been offered a written guarantee stating that if they suffer a heart attack or stroke, they will receive a refund of 100% of the fees paid during the year. To date, we've only had to give one refund. While you might think we achieved these results by catering to already healthy people, in fact, many of the men and women we treat have major cardiovascular risk factors like high cholesterol or metabolic syndrome, a dangerous cluster of abnormalities, high blood sugar, high blood pressure, high cholesterol, and a wide waistline that greatly magnify the threat of heart disease, stroke, or diabetes. Other patients were past or current smokers, were diabetic, which quadruples a person's risk for heart attacks or strokes, had a family history of cardiovascular disease, or were morbidly obese, including people weighing as much as 400 pounds. Many of our patients have already suffered a heart attack or stroke, putting them at a particularly high risk for having another of these life-threatening events. In this book, we'll present the unique, personalized prevention and treatment plan that could save your life. By following our plan, called the Doneen method, you can avoid a heart attack or stroke even if cardiovascular disease, CVD, runs in your family. If you've already had a heart attack or stroke, we'll show you how to keep it from happening again. You'll also learn the action steps you need to take today to improve and protect the health of the most important muscle in your body, the heart, and the most important organ, your brain. The Doneen method has helped thousands of people live active, healthy, and pleasurable lives without the fear of a heart attack or stroke. When we founded the Heart Attack and Stroke Prevention Center in 2003, it was one of the first facilities of its kind in the United States. Our goal was to bridge a deadly gap in the medical system. When we looked for experts in preventing cardiovascular disease, we couldn't find any, even though more than 2 million Americans suffer heart attacks or strokes each year, and of that number, 800,000 die. Although we had thought that preventing these life-threatening events was the job of cardiologists, we found ourselves all too often referring the same patients to these specialists over and over again to be treated for recurrent heart attacks or strokes. One of Spokane's leading cardiovascular surgeons, Lloyd Rudy, MD, told us that after he'd performed several thousand open-heart operations, including bypass surgery, to treat CVD, he thought, "I have lots of patients I operate on every 10 years. What can I do to keep these people from coming back?" We, a family physician and a nurse practitioner, have an answer. To treat the entire person, not just his or her cardiovascular disease, with a comprehensive prevention plan. Dr. Rudy became a dedicated patient of ours and a staunch supporter of the Doneen method. We designed our approach to look at each patient as a unique individual with brains and a life as well as a heart. And we also arm patients with the knowledge they need to navigate the healthcare system, avoid the pitfalls, and be able to insist on getting the best medical options available. Very often, it takes more than the current standard of care to prevent heart attacks and strokes, as many of our patients have discovered. The Doneen method is best told through the stories of these patients. Let us introduce you to Camille. How standard care can fail patients. When Camille Zaleski had her annual checkup, her regular doctor was on vacation. Another MD gave her good news. After checking my blood pressure and cholesterol and plugging the numbers into a software program on his Palm Pilot, he said my chances of having a heart attack in the next 10 years were less than 1%, says the credit manager from Peoria, Arizona, then age 40. She went home reassured that her heart was healthy and was almost certain to stay that way. 5 months later,